So there are a number of different complementary alternative therapies that have been studied to varying degrees to assess for prevention of cognitive impairment, treatment of cognitive impairment. This is not even a comprehensive list, but I did want to go through a few of them that you might have someone ask you about. Ginkgo biloba is probably one of the more common ones that you might run into. It has anti-inflammatory properties, it has antioxidant properties, but truly when it's been studied in large-scale studies, so this was a 3,000 individual study in those who were 75 years or older who didn't have significant cognitive impairment, they found over time that there was no benefit conferred. Additional studies that have looked at a variety of populations have really not been able to consistently find a significant benefit. When it comes to adverse effects, it's fairly well tolerated, but is known to potentially increase risk of bleeding, increase dizziness, cause some diarrhea. So there are some risks associated with ginkgo biloba as well. And of course, thinking about the quality of the products when we look at supplements because of the kind of lack of significant oversight in the production and testing of these types of products. Huperzine A was really popular for a little while. It's a moss extract, and the theory behind it is it has some cholinesterase inhibition, which of course is part of or similar to the mechanism of action of some of our treatment products. It does have some modest benefit when it was studied specifically with some of the activities of daily living, but overall cognitive markers, really, they haven't been able to find a significant benefit in the use of huperzine. It's probably safe, particularly if used short term, so 3 months or less. But keeping consideration that it is a cholinergic product, so we're going to see some cholinergic adverse effects, such as diarrhea, for example, which if someone's already taking an acetylcholinesterase inhibitor may be increased. Another popular one is caprylic acid. One of the names that it comes under is Exona, and this is a derivative of coconut and or palm oil. So some people actually will just consume coconut oil instead. It's pretty safe from what we can tell. Of course, there's oils in it, so taking that into consideration depending on what the individual's other risk factors, diet, etc. But it's likely safe. They kind of stalled out at phase 2 type studies, and most of the studies that have been published or are available are pretty poor quality. They're run fairly uninhibited with the makers of the product trying to tell you how great it is. So it's hard to know for sure the benefit of coconut or palm oil at this point. Coral calcium has had some hype associated with it. So it's a shell-derived type of calcium carbonate. It was heavily marketed, has no substantial evidence. The difference between purified calcium carbonate and coral calcium, of course, it has things like trace minerals, etc. Really, the recommendation is to use purified calcium supplements if someone has other reasons to be on a calcium supplement, such as for bone health. Omega-3 fatty acids, we try to make it a thing. We would love omega-3 fatty acids to be helpful. It's probably safe. There are some bleed risk associated with omega-3 fatty acids, but the research, we need more of it to really know for sure if it truly has a benefit. We haven't found a significant enough. But, of course, there are some associations with reduction of heart disease. If someone has high triglycerides, there can be some benefit there. And then coffee or caffeine. This is an interesting one. So coffee has been postulated to slow the accumulation of the amyloids, right? However, there's this almost like inverse correlate that some of the studies have found where really high levels of caffeine consumption actually may worsen outcomes. And there is some call for differentiation between things like actual caffeinated products like teas and coffees that have other chemical compounds that may contribute versus straight caffeine, right? So is your Bang or your caffeine pills, is that really the same potential benefit that coffee has? Because coffee's got a lot of other stuff in it in addition to just caffeine. So it's hard to know.